Hello, I'm Dan Hughes. I'm a psychologist from Pennsylvania in the United States. I spent my professional career trying to understand and then be of assistance to children who have been traumatized by their own families and are trying to establish new lives with their foster carers or adoptive parents. I was initially very confused as to why they didn't respond to the good care that they were receiving in their foster homes or their adoptive homes. Because I was coming from an assumption that if you provided these children with what they did not get at the beginning of their lives, they would quickly see an opportunity to develop well. But they were not able or willing to do that. So I spent a great deal of time first understanding them and then developing interventions both in the therapy office as well as for the parents and carers in the home to provide these children with the care that they needed and would respond to. The most striking characteristic of these children was that they did not trust. They did not trust good people. They experienced their caregivers, their parents, their therapists, their teachers, their social workers as perpetrators, as people who were going to hurt them. They did not see the intent of these individuals to help them to have a good life. They didn't trust the motives. They misperceived behaviors of the parents or the caregivers, thinking that routine discipline was abusive. And I realized there needed to be a way to help them to experience their lives differently and to want to be cared for rather than to avoid it. So much of my effort has been to understand that and then, as I say, know what to do about it. More recently, about 10, 15 years ago, there was a greater understanding of the trauma that these children experience. The trauma is much more severe than trauma that occurs if a child is bitten by a dog or falls off a horse or is cut accidentally or hit by a stranger. Psychotherapy had really not addressed that, and the therapy for traumatized children had been based on the assumption that all trauma was the same. If you're bitten by a dog, how to help that child get over the fear. But if you're traumatized by your own parents, where these are the individuals that you trust, and you're traumatized many times in your home where you should be safe, it is much more difficult to understand that, to comprehend that, and then to trust that your new parents are going to be different. It's like if I'm traumatized by a dog and I expect a dog to help me to resolve the trauma. Well, if I'm traumatized by a parent and I expect the foster care or adoptive parent to help the child resolve the trauma, it's very difficult for the child to trust enough to do that. There's a consensus now that these children are at risk for pervasive problems, as I said. One is around attachment. They have a great deal of difficulty forming attachment with their foster carers or adoptive parents. And attachment is crucial for human development. There are thousands of studies now showing that securely attached children develop so much better in so many ways. And these children do not attach well. Attachment is crucial for managing any sort of stress, and there's stress always in our lives. It helps us to learn how to rely on ourselves in such stressful situations and how to rely on others, and to know when it's best to rely on self or others. If the attachment pattern is disrupted and becomes disorganized, children cannot manage stress, either relying on self or relying on others. And probably about 70 or 80% of little children coming into foster care have that disorganized attachment pattern. They also have trouble regulating basic physiological states, biological states. They don't know when they have to urinate or defecate. They can't regulate very well emotions. They can't regulate if they're hungry or full. They often don't know if they're in pain. They fall and hurt themselves. They could break their leg and won't even know they broke their leg. They also have trouble, as I just said, about affect regulation, which is the ability to have a thermostat. Terror replaces fear. Despair replaces sadness. rage replaces anger. They don't have a way to keep that moderate, so they're extremely volatile. They also have, they're at risk for cognitive problems, learning disabilities, speech and language problems, auditory processing problems, sensory integration problems, and reflective functioning. The last refers to the ability to be aware of your inner life, what you think, feel, and want, and then also to be aware of the inner lives of other people, to know what others think, feel, and want. That's very crucial, to know the intentions of your parent, whether or not when your parents discipline you, are there intentions to make you unhappy, to hurt you, or to teach you something, develop a habit, help you to contribute in a way that a skill you need to learn. The children also dissociate, which means they are not present. They seem to be daydreaming all the time. They miss things. They don't learn from experiences too well because their mind is somewhere else. Well, it's not just that they're inattentive because they're not interested. It's because they're probably in a bit of stress, and when they go into stress, they dissociate. They just leave the present mentally, and the mind goes somewhere else. They do it without thinking. They tend to be very impulsive, or if they control their impulses, they tend to be very compulsive. They do the same thing rigidly over and over again. But more of them are impulsive, or also very withdrawn and very inhibited. And finally, they have a self-concept that's either negative or it's fragmented. They don't know who they are. They change, and as a result, they have a great deal of difficulty with transitions. It's hard for them to go from one room to another, one class to another, one situation to another, one activity to another. And their sense of self is very, very poorly developed, so that they either have a sense of self that I'm bad, I'm worthless, I'm no good, or they have a fragmented sense of self where they have a hard time holding on to who am I, so they have difficulty with transitions from one activity, place, or relationship to the next. They often feel they lose their bearings, and they need a great deal of help making these transitions. Another way of looking at sort of an underlying factor as to why it's so difficult for them is that our brain is constantly seeking input from the environment. And when we are not safe, which would be characteristic of a traumatized child, we have tunnel vision. We focus narrowly on things that might be a threat to us. So we're hypervigilant to anything negative, a loud sound, a strange situation, an expectation that might lead to failure, someone in a bad mood, someone reacting in a small, ambiguous way. So our brain is so focused on that we miss opportunities to learn left and right. And it's keep us alive if we're not safe. It's to be vigilant about threats to safety. Well, once we become safe, our awareness, other areas of the brain become involved in learning about the world. So we learn as a child should from parents, from teachers, from friends, from the television, from books. And children have a great curiosity about the world when they're safe. When they're not safe, they don't even see those opportunities to learn. They're not interested because their interest is in keeping themselves safe, and that's much more narrow. So as we generate safety, the children are open to new learning, and if they're in a new situation like a foster home, now they can take advantage of a foster home, but they won't take advantage of it if they're not safe. And the third, once we have a period of time like that, where they're learning about the external world because they're now safe, after a bit they start to try to make sense of the external world and how it impacts on them, and then they start to notice what's going on inside of themselves. So they start to be aware of what they think and feel and want, what they wonder about, what's special to them, what they like, what they don't like. That's a later skill that emerges when you're really safe, and many of the children that I've treated who have developmental trauma disorder have no clue. They have no awareness of what they think, feel, and want, or what they like, what they enjoy. Their memory is very limited. Again, we need safety. I'd like to explain a bit now about these children do not trust. And characteristic of the lack of unwillingness and ability to trust is that these children have a great deal of difficulty allowing themselves to feel the pain of rejection, because they have been with abuse and neglect. You're being rejected by your parents. And in order to manage that, many of them dissociate from it. They really find a way to pretend they don't need it, to rely on themselves, to minimize their reliance on anyone else, because they don't want to be rejected again. That is, you're very vulnerable feeling rejected. You go into sadness, despair, loss, grief, and the children find ways not to be sad. And as a result, they have to be self-reliant. Well, if we're going to help these children, they need to be safe enough to be sad, which is somewhat paradoxical, but it's true. Until they're willing to allow themselves to be sad, they will not be open to comfort, which they desperately need, and comfort is crucial in developing an attachment. They also have given up the desire for any joy and delight, because they wanted it, like babies and toddlers, are filled with life and laughter and joy, but it was extinguished by parents never responding to them. So over time, they stopped looking for it. So then, now they're given opportunities. It's exciting, it's joyful, it's loving, and that scares them. It makes them anxious because they don't want to start hoping for it again. So then they avoid that. So they avoid both sadness and they also avoid joy. And the only way to do that is to rely on yourself exclusively, not to turn to other people and relationships. So we have to find a way to do that, to facilitate their ability to turn to others for comfort and joy. The difficulty for the caregivers and the parents and other adults working with these children is if the children have communicated a number of times, I don't need comfort from you, I don't need you to support me, I'm not sad, I'm not vulnerable. As well as, I don't enjoy being with you, I don't turn to you for enjoyment, laughter, fun. After a while, even healthy adults, even adults who are very committed and caring, have been raised very well themselves, over time, it's hard to keep caring for children like that when the child has rejected you over and over and over again. And that term we've begun to call blocked care, or where the parent has stopped caring for the child emotionally. Their mind and heart are no longer open to the child. They may do their job. They may do what's necessary in order to take care of the child's basic needs. But in terms of their heart being there and having pleasure in it, enjoying it, seeking the child out, being really interested in the child, that starts to dry up neurologically. And it's hard for a parent to turn that on through willpower. So then you have a child who is in blocked trust with a parent who's in blocked care, and it's going to be extremely hard to bring the two of them together. Going back to blocked trust for a minute, here's some characteristics of it. Chronic readiness to defend, hypervigilance, reactive, very big emotions, so they will try to intimidate, scream, scare people away, make people not want to bother to be close to them. They also have what we call a negativity bias. They see the negative, they don't see the positive. A parent could spend a day with them and do 20 nice things, and the child was frustrated twice. You ask them about the day, and they will only remember the two things that they're frustrated about. They don't notice cues of safety, enjoyment. They're so focused on the negative, they miss the positive over and over again. The brain has a basic switch. It's the first responder. It's called the amygdala. It's deep in the brain. Sensations go to the amygdala, and the amygdala says, am I safe or not? Well, these children have a bias in the amygdala. There's receptors toward stress that tend to bias the amygdala toward threat, so they immediately will go into fight, flight, or freeze rather than being open and engaged. They mistrust, which means they disengage and try to avoid a relationship with another person, avoid a situation because of that set. It tends to be mindless. It's hard to get these kids thinking and being interested in learning something new because they've just given up on learning. They're so convinced that the same mode is going to happen again and again and again They don't even bother. They're just, how do I keep myself safe because the world isn't going to change? And then they take care of themselves, or what we call provisioning. So they will hoard and keep things to themselves and focus on objects rather than relationships and possessions that they have, including food. They also will block off their inner life from others. They won't share what they think and feel with others, even when they know what it is, and they definitely will not allow themselves to be vulnerable, which is what I said earlier about sadness. It's interesting that the brain now has, as we know more and more about the brain, when we experience pain, either physical or social emotional, and it becomes chronic, there's transmitters in our brain that generate a bit of opioids. So we self-medicate to make ourselves numb from the pain from physical pain, but also from psychological pain. And we also do it when we want to experience joy. Well, there's pain of abandonment and rejection, and it's the same thing. We turn off our desire for pleasure and the desire to be with another person because of we're so certain that it will lead to another failure. So we develop skills. We can comfort ourselves. We have these mistrusting children often have repetitive, self-soothing, self-calming obsessions, compulsions that they do over and over again that in order to give themselves some comfort. They're constantly vigilant. They will go to strangers thinking they're responsible for their own safety, and the best way to be safe with somebody you don't know is to be friendly with them, because they found that strangers in general will be friendly back and less ambiguous. They tend to not be direct about what they think, feel, and want. Not only don't they know what it is, but they're afraid that that will make them vulnerable. So they tend to be somewhat deceitful and to manipulate others. They do not have the assumption that others will meet their needs. They have to take care of themselves. And they avoid closeness. They keep others at arm's length because getting close is going to lead to abandonment and rejection or abuse. And they see peers, siblings as competitors. They just don't believe there's enough affection to go around, and they assume that a parent or a caregiver or a teacher will choose every other child over them. As I said earlier, block care can set in when I'm a caregiver or a parent who doesn't have success in being able to raise a child like this, and the parent goes into survival mode. They get very defensive to protect myself because from the rejection by the child. So just like the child is very defensive, after a bit the parent or caregiver also becomes defensive. Rather than being open to who is the child, engage with the child, the parent is more self-protective, vigilant, ready to guard against anything that the child might do to hurt the parent, either physically or psychologically. And over time, the parent becomes apathetic. They do their job, but their heart isn't there anymore. They want it to be there, but they can't turn it on. After a bit, the parents also only focus on behavior. So I say to them, well, what does the behavior mean? And they say, I don't care. I just want it to stop. And I say, well, until we can understand what it means, we can't get it to stop. We may constantly try to go down the wrong path. And they say, I'm sorry, I just don't have any interest. I just want it to stop. Well, that's survival mode. They're just, they don't have the energy to stop and figure it out anymore. They just want the behavior to stop. They also tend to be hard to keep an open mind. If this isn't working, let's try something else. So many parents will try the same thing month after month after month and just get increasingly frustrated that it doesn't work. Often that is consequences, because that tends to be, consequences tend to focus on behavior. So if the behavior isn't stopping, we add more, or we make it more severe, or a way to help the child be motivated to do something by having a more severe consequence, which again doesn't work. And then the focus on behavior and correction and good behavior, then what is lost is the awareness that correction does not work without connection. The child has to be have that relationship based on trust, enjoyment, turning to parent for support. Without that, there's very few incentives, reinforcements that are going to work effectively. I want to go look at the brain a little bit. I'm sure you've all seen this good old brain. So the top in the front there, on the left side, the frontal lobe, that's where most social emotional thinking, the more reflective bits of the brain, as well as attachment are located, problem solving, complex thinking, delaying, inhibiting, all those good things. And right underneath it, there's another part of the cortex. It's a little lower, and that's where the more emotional bits are. There's sadness down there. Right above that is happiness. Right above that is fear, and above that is anger. And those are the emotional bits. Events happen, we experience those emotions, and hopefully there's many connections between the frontal cortex, the prefrontal that it's called, and the deeper anterior cingulate cortex, so that the thinking can be integrated with those emotions, and it can be, there's context provided, and then there's much better ability to identify and regulate those emotional states. If we don't have all those connections, those emotions could become extreme, and that tends to be a problem for these kids who dysregulate continuously. Also, you see down at the bottom, that A is the amygdala, and right above it is the sadness. Well, there's a gap between the two. It's a different part of the brain, the deeper emotional part around the A, and the cortex, which is the sadness, is at the bottom of the cortex, and the interior part of the cortex, but it's still cortex. And we got to get connections between the two there if we're going to, that also is crucial for regulating both the emotion of sadness, but also for influencing the amygdala, that we don't need to go into fight, flight, or freeze, which is our defensive response, so we could be open and engaged. Okay, as I mentioned, in the deeper part of the cortex, the various emotional states, what we need to do is connect those both to the more surface area of the cortex, the prefrontal area, where the more cognitive states and reflective bits are, as well as the deeper emotional part, the amygdala and areas around that, and the hippocampus, which is more primitive, basic emotion that if left by itself, the child will be in fight, flight, freeze a great deal. We have to make those connections if we're going to be able to regulate emotions and start to turn to adults, caregivers for safety. And this is fascinating in terms of understanding how those connections occur. That picture there of the mother with her little girl, what happens in those types of interactions through facial expressions, tone of voice, how she uses her voice, the rhythm of it, sing-song voice, the gentleness and the surprise and the variations in intensity, overall body language, gestures, expressions, posture, and touch. All those nonverbal communications enable the child to feel safe and respond in kind. And as they're responding in kind, you can see right there, there's a connection between the mother and the little girl. When you see it like that, it's happening in the brain of the little girl too. So she is building a connection between the bottom of the cortex and the amygdala during that activity through there as joy. And there's two primary ways that it happens, the more intense ways. There's the joy that I just mentioned that builds that connection from the amygdala to the up to the bottom of the cortex. There's two examples of comfort and joy there. Both of those are more joy. The picture between the little girl and her mother. She's not in distress there. She might have been, but now she's feeling joy. I put in the wrong picture. What it should be is a child who's crying being held by a mother. Because what we found is that the experiences of comfort and joy are the two most intense human experiences for little babies to form an attachment to a parent that generates trust and safety, so that the child will then rely on the parent for full range of experiences that enable them to develop their brain well, to develop their ability to think, feel, and want, and communicate, and have fun, and also deal with stress. When parents say, what can I do to help my child, the bottom line answer is give them more experiences of comfort and joy. Now that may be hard when a parent is in block care, when they want to focus on behavior. They want, what consequences do I give? And I say the consequences aren't going to work until you're able to provide comfort and joy. I can't do that, a parent might say. Then I have to say, how can I help? How can I help you to take a deep breath and find within yourself reasons to do it again? My responsibility is not to judge the parent who says I can't do it, but find ways to help them to do it. And it probably means I have to stand alongside of them and go with them into their pain, comfort them about how they opened their home and heart up to their child and nothing came back, and then find reasons within them that they can start to hope that it's possible, and to be open to the possibility of someday experiencing the joy that they hope to experience when they took the child into their home. That's what professionals, our responsibility is. If we can ask parents and caregivers to give comfort and joy, we have to help them define within themselves comfort and joy. Once we have that, then the incredible thing about the brain, this is all depending upon good experiences, primarily in the first few years of life with your parents, your caregivers, or substitute caregivers. During that time, those experiences that you have with parents are shaping the brain and making the brain more dense. It's creating more nerve passages from one part of the brain to the other. It's sort of an elaborate motorway system where they're all interwoven, so the thinking influences the feeling influences basic physiological processes, memories involved in there, seeing the context, being able to inhibit, moving into planning long-term goals, as well as who to trust and who not to trust, differentiated learning. All those things occur within the context of good relationships. When the child has to do it alone because of mistrust and they rely on themselves, it's sort of a fast track toward maturation, where a child, I'll rely on myself, I can do it by myself, and they really work hard at it, but it doesn't work well. They work hard at making decisions and they can't make decisions, at inhibiting and they can inhibit. Or they inhibit, but at the expenses, they never have any pleasure, no joy. They don't know how to play. They don't know how to have friends. They don't know how to do the normal activities of childhood that safety would give them, where they're able to turn to parents for comfort and joy, and then turn to the world for pleasure, for play, for fun, for laughter, and for new learning, to learn about the world in terms of what's exciting about the world. This is a summary again of it, comfort and joy, which are the most intense experiences. But the background experience in which those two are more likely to occur, it's called a mental state that is called by neurologists as being open and engaged, where you're open to the world and you're engaged with the world. You're interacting. You're just not observing it. You're actually interacting with the world. That part, that area of the brain, I shouldn't say area, that system of the brain is functioning. It permeates the whole brain when you are safe. When you're defensive, it doesn't work very well. And when you're defensive, you're not open for comfort and joy. So our job then in helping these kids to be open and engaged is to stay open and engaged ourselves. And that could be a challenge when we're interacting with a child who's spitting at us or ignoring us or yelling at us or deceiving us or just wanting to have nothing to do with us. After a bit, it's hard to stay open and engaged. If we're able to do it, then after a bit, the child is likely to relax his defensiveness and start to be open and engaged. But that's a challenge for us. We have to really be aware. It's hard to use willpower and make ourselves do that. It takes a lot of awareness, reflection, turning to yourself just to stop and make sense, to inhibit your tendency to become defensive, react, become angry with the child, and then to be self-reliant ourselves and not to turn to our partner, our friends, mentors, because in raising a child, to teach this child how to trust, probably we can't do it alone. We probably need a team of adults around us for the support that we need to keep going when we get nothing in return in terms of the child's response. And when I was learning how to relate to these kids in a way that they would actually respond to me, be interested in me, be engaged, listen, and be open to my influence, I realized I could not do that by being stern. I could not do that with threats or rewards. They didn't work. I had to do that by having a relationship or inviting them into a relationship in which they could be open and engaged too. They would have to be safe with me. Well, what kind of a attitude did I need? And as I looked at it, trying to give words to define the different aspects of it, what came to mind was pace. Being able to be playful, accepting, curious, and empathic. And I realized if I can stay in that attitude most of the time, not all the time, there's no way I could stay in that attitude all the time. I'm a human being, not a robot. But if I could stay in that attitude most of the time, often children would gradually start to be open and engaged with me. They would have a hard time fighting with me. They'd have a hard time being angry with me. They'd have a hard time, over time, through a lot of repetition, hard time resisting the desire to trust me, to rely on me, to laugh with me, or even to cry with me. Because this attitude is so non-judgmental, so inviting. It's light, but it's also empathic. It's helping children to know we don't have to avoid and run away from hard things because comfort's available that will enable you to make sense of them, reduce them, and experience a way of making sense of them, looking at them somewhat differently so that they don't have to terrify you anymore. And as your mind is really open, you start to notice that your foster care is not your abusive parent. And you start to discover not only are they not them, but they have something to offer that you never imagined a parent, an adult, would offer. Many things, such as putting your interests first, noticing what you think and feel and want, supporting you, being ready to help you with the hard times, and being interested in sharing joy with you and activities with you, being delighted in who you are, as well as discovering qualities about you. So in my work with parents, much of it is to help them to see the value of pace, being playful, not always playful, not if the child is screaming or crying, I'm not going to tell jokes, but having an openness, a lightness, so that the conflict, the problem, the discipline issue is not the end of the world. The relationship is bigger than any conflict or any discipline. The relationship gives a context in which the problem can be sorted out, managed, and yeah, we get knocked off balance a bit, but we keep coming back. Acceptance means accepting the child's inner life, who he is, what he thinks and feels and wants. He wants to be left alone. I accept that. Now I might challenge his behavior a bit if he turns his back on us and just wants to spend his whole day in this room. But his desire for being in the room, I have to accept he wants it. And then I'm curious about it. Why do you want to spend your life in your room? Well, probably because he doesn't think if he's with a family that he will fit in. He probably feels that they will be disappointed in him. Or they may ask him to share or ask him to have fun, and that scares him. So he could control what's in his room. Doesn't offer much, but it avoids frightening things. So I have to accept his wish, help him to understand it, have empathy for it, and then he is much more likely to take a deep breath and come out of his room. I'm not going to drag him out of his room, and I'm not going to ignore him and let him set his own pace, or it might be in his room for years, never having any confidence to take the initiative. The curiosity is, hey, I wonder why you did that, rather than why'd you do that. Curiosity is just trying to get to know the child's inner life, helping them to be safe, helping them to start to wonder what they think, feel, and want, so that they can start sorting things out themselves and know what's really in their best interest at a deep level. And the empathy means you're not alone with your pain and your sadness. I'm with you in it. I'm willing to stay with you in it because you're important to me. Sometimes parents will say, I can stand that attitude when the child is cooperating, which, yes, that's the easier time. But they often think that it doesn't work during times of discipline. Well, partly because they don't use it during times of discipline. Many of us, when we discipline children, we have an edge to our voice and sort of somewhat of a sober, serious, stern threat in our voice and our face. Because that's how we were raised. No big deal if we're securely attached, but it is a big deal if you have a mistrusting child who just takes it then as more proof of not being liked. So if I can discipline with empathy, acceptance, and curiosity, probably not playfulness during discipline, but once in a while maybe, rather than anger and threats, discipline works so much better. It doesn't give me a headache, and the child doesn't see discipline as a threat to self. It's just the child gets it. It's about my behavior. It's not about me. So I really encourage parents to practice using pace around times in which they have to discipline the child too. So this is what I'm asking in parents, to have a compassionate state of mind, I call it, where the parent can interact with the child from their prefrontal cortex, from their anterior cingulate, where they're able to maintain a reflective, empathic, intuitive, somewhat patient, mindful stance toward their child to help the child move out of his basic fight, flight, freeze and move into a similar state in their mind. Because two brains tend to want to synchronize. That's my goal, to help my child's brain mirror my brain as long as my brain invites the child into a relationship. The bottom, if we're both defensive, is probably going to escalate. And we'll both get more and more angry, or more and more withdrawn physically or mentally, or we just don't notice each other anymore, don't care, ignore each other. And that becomes a deadly cycle. So when you have block trust and block care together, that's the danger. What I want to do is try to influence the brain of the parent and the child and have a connection at a higher level between the two brains, which is called intersubjectivity by the researchers, in which my experience, which is positive, of the child influences the child's experience of himself and of me. So if I experience what's underneath the child's behavior, his behavior is angry, and I can see underneath his anger is fear of abandonment. I could see when the child is very avoidant, again, it may be fear, it may be shame, he's vulnerable. And I could have empathy for that, and then the child starts to experience himself as vulnerable. And then he could show his sadness rather than his anger, his fear rather than his shame. And he could go into being open to my experience of him. So I have to help a child to be able to experience himself the way I do when I'm able to maintain a state of mind where I see and experience him underneath the symptoms, underneath the problems. I see them as strategies to survive, that he wouldn't have had those if he had had good care at the beginning. He would have been able to engage like other children do in a very cooperative, regulated, interested openness to the world and to relationships like other children do. So that's my goal, to help my mind, help as a therapist, enable the parent's mind to help the child's mind then to move into a relationship based on connection rather than defense, mutual defensiveness. And this is what my ultimate goal is.
I want the parent to be able to never forget that much of the child's challenging behavior comes from an effort to survive trauma that we probably can never imagine. You're an infant, you're a toddler, you're a 3-year-old, and you're being screamed at, threatened, dragged by your hair, locked in a closet by people that you assume love you more than anyone else in the world. Well, this child is probably going to think that every adult in the world, if I can't trust my parents, I can't trust anybody, as well as I shouldn't trust because I'm a bad, unworthy child. Well, I have to help a parent to keep that in the back of their mind and see that's probably central in the child's misbehavior. This is not an excuse. He or she still needs to learn how to act in a way that is socially appropriate. Otherwise, they're going to have a hard life. But they need so much support to do that, so much understanding, so much pace, so much patience, if they're ever going to do that. Threats, consequences, just not going to do it. I have to find a way to keep myself feeling warm toward this child, affectionate. If I can see underneath the child, I might be able to do that. But it still may be hard to do it consistently over time, so I need somebody who can be supportive of me. I have to have a partner, if not a partner, a best friend, a colleague, a mentor, some support, somebody who gets it, who isn't judging me, who knows how hard it is, somebody who has affection for me, and then I'm more likely to be able to maintain affection for my child. I have to discover something delightful about my child, something I can enjoy and laugh about. I have to see qualities in them that other people can't see. We do that naturally with our babies. We always see positive qualities in our babies that other people don't see. We laugh about it. But they're probably valid. Other people just don't see our baby as well as we do. Well, I have to find the child underneath the symptoms in order to take delight in that. It's hard work. I have to really give myself a pep talk and inhibit my first reaction, which might be defensive. I have to realize that I'm going to mess up as a parent, as a caregiver. I can't be perfect at this. I'm a human being. Some days will be hard. Some days will be bad hair days. Some days I will blow my top. But I can't go into shame. I can't go into despair. Well, I might not be able to stop it if I'm all alone. That's where I need the support. But I really have to cut myself a bit of slack on this because it's a marathon. There'll be ups and downs, fast and slow, and I can't expect that this child is going to respond in a week or a month, or possibly not even a year. I wish I could offer that to parents, but I can't. We don't know how long it will take, but we know that there will be ups and downs along the way. When the child is rejecting me, calling me names, you're stupid, I don't want to be with you, leave me alone, you're not my parents, a good way of looking at it is, what is that? It's misplaced mistrust. He or she should mistrust their birth parents. They should. They were violated, betrayed by their birth parents. And now he or she is giving it to you. So the rejection that you experience is really rejection that should be going to the birth parents. Now, you say, well, it's still hard. It is still hard. But if we can keep that in mind, that in some ways the child doesn't know who you are. The child sees you as the birth parents. Then my job as a therapist or social worker or professional helping you, and probably your job, is to find ways over and over again to help your child see that you're not the birth parents, to differentiate you from your birth parents. Because when he or she is able to do that, then the mistrust will go where it should go rather than to you. This is, I just said, another way of saying it, generalized mistrust. It goes to everybody rather than to where it should go. I have to make myself approachable. I have to find a way, again, to give myself a pep talk, take a deep breath, maybe even fake it a bit. Really work at it in order to get in a rhythm with my child that after a while I start to feel a bit of it again. it's a marathon. I may not feel it at first, but many parents will say if they want to sit and just avoid their kid, it's quiet, they give themselves a pep talk, they get up and start to engage, interact, do something. 15 minutes later, they're actually enjoying it. Half hour later, they're disappointed they have to stop to handle some responsibility. If I can remind myself of that, it's going to take time and repetition, and take a deep breath and get started. I'm going to have to remind myself of that, actually, because it's going to be a lot of that before it starts to become easier. This last, another thought that I have is that we tend to get defensive, we're human beings. If I could start catching that, noticing it, be aware of myself when I get defensive, just notice it, then I'll probably be able to be aware of thoughts, feelings, even gut feelings that I have that are early stages of defensiveness. The more I could reflect on that or be mindful about that, just notice it without getting defensive about noticing it, the more I'm able to catch it, release it, and get back to be open and engaged. As a therapist, early on I thought I should like all these kids all the time. And I realized that rarely there weren't bumps on the road because the kids were so good at making me angry with them, anxious, feel like giving up, and feel inadequate when I was with them. So the key then wasn't to pretend I didn't get angry, anxious, give up, or feel inadequate. The key was to be aware of it, because if I was aware of it, I could often just think about it, realize where it is coming from, like misplaced mistrust, a child who was violated terribly, have compassion, and then get back into be open and engaged. But I had to be aware of that defensive, and then release it, let it go. I have to be able to relax. It's good to be able to relax somewhat with my kid, but sometimes I can't. So I have to have places where I take care of myself, or with other people with whom I can relax, or I've saved places where I am alone, I have a break, and I can just clear my mind, center myself, find a way to take a deep breath, and again, remember it's a marathon. I have to be aware of the triggers of this child, in which the child's behavior maybe remind me of my own parents' behavior, or my own behaviors when I was his age. So I have to be aware that I'm not a robot again. I have a history, and qualities in the child, behaviors in the child may trigger something in my own life, in my own history, my own values, my own perceptions that cause me to become defensive and reactive. If I'm aware of those, there's a good chance I can learn how to deactivate them. I need a good support system. I need a team. I need, we don't have to be that formal about it, I need family and friends who will support me, who will be with me. And I have to be able to play too. If I can't play a lot, I'm not going to help this child feel safe enough to play. If I don't play a lot, it'll be hard not to get very serious all the time. And if I'm serious all the time, probably it's going to wear me down. Play enables us sort of recharge our batteries with laughter, with a bit of joy, a bit of pleasure, even during the hard times, and that can keep me going. So we can't forget to play. Well, that's a basic overview of ideas that I've developed over the years, from reading, from thinking, from talking, from learning. Much of these ideas are summaries of what I learned from parents, caregivers who are suffering. I learned in university that wisdom comes from suffering. I learned that in many ways. And so some of the brightest people I know are foster carers and adoptive parents, because they've suffered a lot in trying to raise kids who mistrust them. So I hope you see this as a summary. It doesn't, don't take it as always right or necessarily right for your child in this situation, but as a guide to keep an open mind to interventions or ways of looking at your child that may actually add something to what you're already doing, help you to stay focused on the long term, help you to see who the child is, who they were probably born to be before they started to mistrust so severely. In doing that, especially as we're able to sort of keep our mind focused on the need, long-term goal, generate a bit of comfort and joy, then probably there's some hope. Well, definitely there's some hope that we can help the child from move from mistrust to trust, and to keep ourselves in a state of mind that provides good care for the duration. Thank you. Much of my focus is with foster care as adoptive parents, as the primary caregivers for the child, as it ought to be. Children should live in families. At times they're not able to because of the severity of their challenges, as well as lack of good foster care. In that case, they need to be in a residential facility, residential home, group facility. Residential workers also need to provide good care. The same things apply for a residential worker. How to facilitate the child's ability to have comfort and joy. Residential workers certainly can utilize PACE. Children can respond in residential care when the residential care facilitates relationships. Too often residential care focuses only on behavior, thinking it would generalize, when in fact it doesn't. Without the relationship, good behavior doesn't leave the facility. Children need to learn relationships if they're going to learn how to do the developmental tasks that they need in order to have consistently socially and emotionally appropriate behavior. The same holds for teachers, social workers, any adult who relates to these children. If that adult is going to have a positive influence on the child, and the child is going to trust that adult, engage, relate well, and be open to change through the relationship, that adult needs to have the same principles that I stress for foster carers and adoptive parents. PACE has to be central in the way they relate, as is that open and engaged state of mind, and finding ways to continue to care when the child doesn't want the care. And that probably also involves a team for the teachers and social workers, an organization that enables all the adults who work with these very challenging children to remain safe and supported within their organization.